Well, good morning and welcome. I was excited to give this presentation. I was asked a while back to be able to present, and of course they talked about the visual literacy, and I'm thinking, sure, I can do that. And then I got to thinking, make sure I understand what visual literacy is. I mean, kind of do it every day in and day out, but I had to do a little bit of research on it. But anyhow, I was excited to do it. And so today, I'm do a little bit of a definition for you about visual literacy and how I interpret it and what I understand it, and especially in the medical world. And then we're going to look at some tricks of the trade that I use as a medical illustrator and some new developments that hopefully you'll appreciate and understand. And then take a look at the VIR, virtual immersive reality, and what we're doing at the University of Toledo at the new center. And then we'll wrap it up with a little conclusion and let Dr. Baptista get on the way. Again, looking at the definition of that term, I went online and I actually found your guys' definition of visual literacy. It's a very handsome and very attractive definition. And so I read through the whole thing and I got a little excited about it. And I'm going, okay, I think what I do as pertains to this. But then I looked at the brochure later on and saw a blurb online. And this baby wrapped it all up in just a few words. A picture's worth 1,000 words, and that's my motto for everything I do in the visual world. And I said, this is great. This is what we do day in and day out. To give you a little bit of background about where I come from, I'm a four-year graduate from the University of Toledo. My background is a dual major in art and science, the fine arts, as well as the science, so histology, embryology, physiology, all the ologies. And then I went on to a master's degree at the University of Michigan in medical and biological illustration, and then, of course, at the University of Toledo from that point on. Visual literacy in the world of medical illustration, again, is a daily challenge for us. This is what we really do. I just had to think about it a little bit more. But the challenge for us is to represent or describe a region of anatomy or even a surgical procedure in a literal sense, and yet convey an incredible amount of information, visual information, that without narrative or written description can direct, can lead, and instruct with a high degree of certainty in a very specialized area of science. And it's a challenge, but it's something that we do every day, and it's something we have to do. Medicine's very complicated. Some of the anatomical events that we'll show you today are foundational in the medical students' background. It's just in their careers. There's a lot more they need to learn, a lot more they need to apply. But again, we are by trade medical visual communicators, and we create images that do a lot of things, but just to give you a checklist, provide a common experience when we look at something, especially a visual interpretation of it. You see it as I see it. It is a universal language. It takes some of the obscurity and the ambiguity out of what we're looking at, and that's very important, especially in medicine. I always describe, I do some medical legal work, but if you're trying to tie off or ligate a structure inside the body, a ligate is a ligature, but improper ligation leads to litigation, and we don't want that to happen. So we want to make sure you understand what you're doing. So again, that's part of my job to help you see that. Again, can lead and direct, and most of the illustrations that we do are step by step. So it's kind of like we're going to take you from point A to point B or C or D, and to get you through that surgical or operative procedure. But it's not a cartoon, but it does lead you along the path of instruction. Provide more detail with less confusion. A lot of times I'm told that there's photography. Why do we need an illustrator? Well, photography is great. It does capture the moment. And there's a lot of detail, but there's some extraneous material that could be there that maybe we want to accentuate something else within that photograph. So for the illustrator, it's our ability to decipher that information and maybe downplay some of the surrounding material and focus it on the information that's pertinent for what you need to learn. So we can illustrate or accentuate that with some of the skills we have. Provide credibility and authenticity to real patient data sets of what we've been using. So it's not just the illustrator has to create a tumor or a femur or a fibula. Now we can actually go in and get your patient data sets, CT, MRI, and use a part of that imagery for what we use in our creations, whether it be an animation, illustration, or a journal article. Induce a greater sense of understanding, accelerate desired learned outcomes, and that's exactly what illustration and animation and, of course, a visual interpretation can do. We can get you there quicker, we can get you there easier, and hopefully a bit more accurate, because this is science. And, of course, it helps us tell a story, and that's the most foundational, important part about what we do, is tell the story. I went outside and actually took a look at most simplistic views I could see that were somewhat medically oriented in a fashion with visual literacy. And I look at these two different symbols. And of course, they both mean the same thing, but look at the amount of detail that we at least get in the one in the lower right-hand corner. There is a sense of the level or the depth of the water. You can see that the body's halfway out of the water and halfway in. They use these little electric or lightning bolts that are pointing to the cervical region of the neck, meaning you're probably going to do some damage or injury there. And of course, red by the head. Anytime you use red in medical illustration, it's very good. We get everybody's attention with that. Again, very simplistic, but two different ways of looking at it, and one conveys a lot more information. But again, visual literacy in its simplest form. Enough said. We've seen this on TV. I don't have to say any more. This is a universal symbol, universal language, so we need to go there. But you can see how powerful it is. Two guys that are trying to actually help us explain what's going on inside the human body, and it's Leonardo da Vinci, and we have Andreas Vesalius. And they're both brilliant individuals in their time, but they spend a lot of time looking inside the human body, trying to explain the inner workings, inner relationships of the structural relationships. And of course, it's trying to have that X-ray vision eye, trying to look inside the body. They had to do a lot of dissection, which wasn't popular back then. You weren't supposed to cut into the body as much as they did. They got away with it. Thank God they did a great job and helped us advance medicine. But I like this guy here. He's the guy that really got the job done. X-ray vision eye, looking into the human body, being able to see what's going on. Now he's being a gentleman, and quite a gentleman, not looking at this lady in a provocative way. But for me, I took the different route. When I was a little guy, remember they had bazooka bubble gum, and you had bazooka bubble gum, you had to peel off the wrapper, and you had a comic strip inside there. And you read the comic, laughed a little bit, but on the back side was always a special offer. So if you saved up 500 wrappers, comic strips, and mailed those in along with $2, you could get a pair of these. So we got X-ray vision glasses, allows you to look inside the body. Of course, I didn't know that the undergarments of ladies were 98% polyester and 2% kryptonite, and they just don't show up very well. Again, that was a part of what we thought X-ray vision was all about. Maybe a more practical use is maybe somewhere along this line, so we can kind of see through what's going on. Okay, so the tricks of the trade that we use, and again, trying to get information, especially visual information that can be very complex and it needs to be very accurate, is we look at the radiological modalities that are out there right now that are really impacting my career and my life. X-rays, traditional, everybody pretty much knows what an X-ray, you've probably had a few of those. MRIs, CT, PET scan, ultrasound, of course, not a radiological event, but does give you an image of a fetus or a baby or some other events that take place. Again, just a couple of them. And then, of course, these things, there's viewers out there now we use to look at the CT and MRIs, and they're very powerful. And they're actually bringing them down to the desktop, which is actually convenient for me. There's a bunch of them. There's a whole bunch of them on the market. But again, we can bring them to the desktop. They run on your computer, and you can adjust the color, you can adjust the opacity and transparency, you can rotate the body, you can record movies of the body, and then you can do a thing called segmentation. So if, God forbid, you're in the emergency room, we get your CT scan, and we do see you have a fractured femur or tibia, whatever it might be, we can take that image, park it on a computer, and we can pull out that fractured leg in a matter of minutes, turn it into a three-dimensional object. We can start to apply screws, pins, and plates to it and do a pre-surgical intervention before we do anything to you at all. It's pretty powerful, and it's quite exciting, needless to say. This is a traditional approach to how I was doing, if you will, visual literacy. And this is used in a courtroom presentation. And of course, there's some labels that are up there, and some of them are missing because this was an old way of doing illustration. But this is a lady's hand, and you can see that there's quite a bit of superficial damage to the skin and vasculature and some muscle. And then off to the right, you can see, they didn't have to use any skin at all. I'm just showing you how deep the injuries are by looking at the skeletal components. And so it's one way you can do a comparison. But visually, if there's no labels up there at all, you'd understand this is a pretty serious situation. And this lady's actually walking down Maumee Bay State Park, and the guy's Flanders remote control airplane that got out of the radio frequency and came down and crashed on her hand. Very powerful. So another technique we use is a lot of Photoshop, and so we do a lot of layering techniques. So the way we put this individual together, I actually photographed a cadaver, took that individual, changed some of the characteristics because we don't want grandpa to show up on the screen with the children in the audience. Grandchildren may recognize that. So we do change facial features, but I took a dry skull specimen, parked it underneath. We got some brain that we dissected to the anatomy lab, and then we actually illustrated in the trigeminal nerve that's sitting back there. So you can see quickly, this illustration is not to show you everything, it's just to show you some of the complexities that exist there. A traditional CT scan, and we're looking at an axial slice too, probably the heart, the aortic arch, not quite the aortic arch, but the aorta, and there's pulmonary vessels there. And if you're a radiologist, you could probably instantaneously make an understanding or see that we've got a rib fracture that's sitting on this person's left side. You're looking at it from the feet on up, not head down, just to give you some orientation. But as an illustrator, I need to get you there quicker. I need to show the students, what does this mean? So I did a little photo retouch. And so now you can see there's a chest tube that's sitting inside the lung. He has fractured ribs. The ribs have fractured beyond. They've punctured the lung. Now we've got air or gas that's leaking out of that lung. It's underneath the skin. He also had a pneumothorax, which is air that's trapped in the upper part of the lung. And that's why that chest tube is in there, to apply negative pressure and to reestablish the negative pressure in the lung so it inflates and he can breathe again. This is the same individual. CT scan, and I just gave you a couple of different slices and a couple of different views to it. And again, I can control that with the slider, so I can show you a lot of tissue, or I can show you a little bit of tissue, and I can look at the skeletal components. So if you look at the right side, and if you look at about the rib 5, 6, or 7, they're sitting out in space a little bit, and they're really, really fractured bad. So it's just kind of a nasty event that took place. This is the same individual, and this should play in itself. This is just the power of it. So we're looking at his skin, we're peeling it all off. And then I'm going to rotate it for you just a little bit, just to show you what kind of flexibility we have with these tools. And again, we can colorize, we can change the color of the muscle, change the color of the skeleton, if we needed to do that to accentuate parts of it. But again, we can rotate it and do what we need to do to show you the extent of injury if we need to. Again, you can see some of the fractures that are taking place. If you're real good with the bones, understand the skeletal components, that's the head of the femur you're seeing right here in his right side, and it's got a nasty fracture through the head of that femur, so that's fractured pretty bad. You can see the ribs right there. There's quite a few fractures there. And if you look at the scapula, the shoulder blade, that's pretty messed up. And you can really tell because we got a nice comparison. The body's bilaterally symmetrical, so we have an instant comparison. That scapula is comminuted fracture and needed some repair as well. I have a chance to get in the CT scanner, literally get in the CT scanner. So I put my foot inside of a Nike free air shoe, and I flexed it like I was going to sprint, and then they did the CT scan on my leg. So I got to know what it was like to be a guinea pig. I was in that bad boy, but they got the CT data. This is a 0.5 millimeter slice, and the power that we get out of these viewers are just incredible. So I can get some of an image that kind of looks like it's silly putty. But I can take a look at the musculature inside the leg, and then of course we can also do some settings. We can look inside the foot. We actually presented this to Nike, and I kind of tried to entice them to work with us a little bit. And they asked me, they said, "Where did you get those images?" Like I said, "We can see how you built your shoe." And they go, "Well, where'd you get those?" And I said, "Come on, Nike. It's for me to know, for you to pay and find out." So I said, "You're not going to know." So I didn't tell them. I did tell them we did CT scans. So anyhow, again, this is just some other images I wanted to show you. Cross-sectional, and I'm kind of playing, this is the artist coming out in me. I get to play with the lung density and opacity, so I'm changing colors, and I'm allowing you to look down inside the heart. And this time we are looking downside because I rotated the body. And just another one. So it's kind of this is the trachea, and you're looking up through part of the trachea, and we've kind of cut through the bottom parts of the lungs looking up towards the head. The heart's not there. We can kind of diffuse that out of there. I got rid of the heart tissue and just exposed the pulmonary tissue that's in there. An apple, and I've shown this before, but this is an apple, and I said, "Why are you putting an apple up there?" Because, well, it's a different tissue, it's a different density, and you never look at an apple like this. You guys eat it, chomp on it, and throw it out. This is a distribution center for the nutrients and the water that goes out to the parenchyma, the meat of the apple, which you consume and eat. But you see the genetic components, you see its beauty, its volume, and really in one fell swoop, I've covered 3 curricula because it's artistic expression, it's scientific expression because we can talk about how fluids get in, the bruising on that skin as relationship to how we bruise on our own tissue. And then truthfully, mathematically, if we put this into a program of geometry, there's no reason why students have to plot on graph paper. We could plot in real time and create a vector or a vertice through that apple or whatever that object might be and watch the input of data show up on the screen. So you have a chance to even go into the mathematics with this type of work. And it's fascinating. And of course, we've been there quite a bit doing these things. I got crazy, did 25 more fruit, and we made a game. We made a game out of it, and it's online. You can pick it up. It's 3D fruit revealed, and we allow students to look at the cross-section of an apple or 25 other fruit and try to look at the seed configurations and the surface of it and try to figure out exactly what it is. Of course, we radically changed the colors. We didn't want these guys to have too much of a leeway on it, but some people have an idea what a dragon fruit looks like or what a star fruit might look like, but it's kind of neat to look at. So let's talk a little bit about the center. This is it's got a long name, the Interprofessional Immersive Simulation Center, and this is the new center they put up on the South Toledo on the Health Science campus. It is let me get the facts up here. It's the first tri-centered concept providing the widest range of modeling and simulation. And today, I think a number of you are going to travel over and visit with us today. In fact, Carlos and I are both going to be over there giving some tours and showing you around. But I'll give you real quickly. Located on the first floor is the Virtual Immersive Reality Center. And it's got the first iSpace 5-sided LED cave. And it's phenomenal. To get you in there, you will have a great time. So you need to make sure you slip off your shoes, put on the slippers that they have, because the floor is a 2-ton, 10 by 10 sheet of glass, which is probably about 10 inches thick and came specially from Belgium. So you get to walk on Belgium glass. And it's got projected from underneath the floor, and it's a fascinating event to be into. And it'll get your attention, I guarantee you. They also have curved CAD walls and 2 flat CAD walls that we can project in 3D, and we can use CT or a lot of other images that we create in some of the programs, 3D programs, to look at these. Second floor is the Advanced Clinical Simulation Center, which has high-fidelity human simulation patients. And as I refer to them as EP or electronic patients, I guarantee you they're not your battery-operated mannequins. These things are fantastic. And they talk to you, they react to you, they have chemistry in them, they bleed, they have all the different physiological functions you might not expect, but they do. They're really fascinating. So you need to check that out over there. If you get a chance, get up to the second floor. The third floor is more progressive anatomy and surgical skills center, and it offers surgical skill training, and these are where trainers or instructors will come in, help you use the medical devices, and maybe improve technique or help you understand what you're doing to sharpen your skills if you need to go that route. This is the iSpace. It's going to give you a couple of images here. And again, you can put probably about 5 people into that space comfortably. You do have head tracking device on those. So as you move in the room will move with you. And so you get a chance to actually look and feel and see what's going on. And it really does play on your emotions because you're dealing with volumetric and space. So it plays on a lot of different senses in your body. And it really is a phenomenal opportunity to get in there and experience what the volumetric render is about and what the VR is about. One caution is if you move too fast or you start to move around too much, you can get vertigo. So we got to be careful how we allow students or faculty or users to get inside. I'm standing in front of a curved CAD wall, and I'm doing a virtual dissection on a head, so I can peel the skin. I actually pulled the skin off of this model we have, and then you can begin to dissect and pull these different pieces and parts of the anatomy off. And again, this is a pretty simplistic model by nature. The OR room that we have it sitting in is just a floating head that's sitting in this OR room, but we have the ability to go into our OR, photograph it, bring it back, project it into that room, and if there was a certain piece of apparatus, mechanical device that maybe we wanted personnel to activate while they go into the room, then we'd be able to go into this room, take the wand, be able to turn it on, activate it, and then make sure they're going through a necessary protocol if that's what was required in this particular space. Again, we programmed some things. We're looking at CT data now in 3D on this wall, which is pretty impressive. Actually, I have it come out at you, and we can look at pathologies, which is quite dynamic. This is the hub or the center that's upstairs on the second floor. And again, you feel like you're at on the Starship Enterprise. And when we looked at this center, it's truly amazing. And they said, Roy, is there anything that you don't like about it? I go, yeah. I said, I haven't met Captain T. Kirk. I said, Dr. Spock doesn't exist. And the most disappointing thing, I said, your transporter's still in elevators. I said, come on. I want to be transported somewhere. I want to be able to be beamed up. Just didn't work that way. And then, of course, this is the third floor where we have the simulation. Right now, these guys are actually using the laparoscopic approach to trying to tie knots. So it's a little difficult. In fact, if they had it fired up, they would let you go up there and try to tie some knots, and it's pretty cumbersome, so they have to practice. And they're timed on these things. They actually have little timers set aside to make sure they're doing it right, and they have to meet proficiencies in order to be able to move on to the next level in their operative procedures. All these rooms are equipped with cameras, televisions, TVs, everything. They record it all. So even if you're on the second floor, the first floor, not the first floor, but the second floor and third, they will record the entire event, and then it's all played back so that the student and the professor can see what they've done appropriately or what they need to improve upon, or maybe some things they should have done differently. It's actually quite nice. So why the VIR? Well, I'll wrap it up for you right here. The improved technology it made it a little bit more cost effective for us, and made this experience possible. It is still an expensive endeavor, don't get me wrong. The technology there's a lot of computers that are driving it, there's a lot of software that needs to drive it, but it's a unique and dynamic experience. The motion tracking and sound, it's an active experience because you have a controller. You can either use a wand that you can control, or use an Xbox controller that you can navigate through the environment if you care to do it. The millennials jump on these things and just cruise on them. We have an image of the solar system, and they have this meteor complex that's flying around the asteroid belt, and we have some high school kids, and the guy just grabs it, jumps on the asteroid, and rides around the asteroid in 3D on the space, and of course all of his friends were amazed, and his students were like, "Hey, way to go, Johnny." But it was pretty neat. It's pretty sharp to see it. So again, provider can, when you're in these spaces, you're in control, so you go at your own pace. So you're pacing yourselves, and it just helps you to see and visualize and maybe understand a little clearly, as opposed to somebody speaking to you and hoping you learn. You can actually learn a little bit more because you're in control of the whole thing. You're pacing yourself. The volumetric CT and anatomy, again, colorize, rotate, fly through. We talked about this in coronal, axial, or sagittal sections. So there's nothing you can't see inside the human body. It's pretty remarkable. Adjustable levels of transparency and segmentation we talked about. And again, the last point on it enhances and fosters a greater knowledge and retention by providing a wider range of variations. So we can program a lot of things into the experience that normally you might not see, and allow you to experience that. And then the sensitivity of the environment can incorporate emotion as a part of the learning experience. And again, whether or not it's vertigo as a part of the emotion, or it's the fact that you're trying to identify where you are in spatial relationship with volume and with objects. It's truly a unique experience, and the only way I can say you can understand it is to get over there today and get in the eye space and enjoy it. So thank you very much. I'll let you take over, Carlos.